And good morning, and thank you for joining us for the Career Services Employer Spotlight. My name is Amy Itis, and I'm a Senior Career Services Advisor at Rasmussen University. Now, these employer spotlights are designed to educate job seekers about organizations and the opportunities that are available with those organizations. Today, the spotlight is on Mercyhealth. I'm excited to introduce our guest, Kimberly Scatia, Vice President, Revenue Cycle for Wisconsin and Illinois. Kimberly, thank you for being with us today.
Thank you for having me, Amy. I'm super excited to be here.
Great. A lot of good information. And let's just start with, Kimberly, please tell us about Mercyhealth.
So if you don't know about Mercyhealth, we are a regional health systems with 6 hospitals and 85 primary and specialty care locations. We run throughout approximately 50 northern Illinois and southern Wisconsin communities. We have approximately 7,500 employees and over 700 employed physicians. And our employees and physicians, we call them partners, and they truly take our brand expression to heart. We have a passion for making lives better. We are committed to working together to make lives better for our patients and our families in the community. One of the things that many people may not realize about Mercy is that we're an integrated healthcare provider. So that means we do provide coordinated care that spans across 4 core service divisions. That includes hospital-based services, clinic-based services, post-acute care and retail services like pharmacy and things like that. And we also have our own wholly owned insurance company. So our career paths at Mercy go way beyond the ordinary. Like I said, we have over 7,500 employees. We refer to our employees as partners, and we are really committed to providing the most advanced healthcare services with compassion, dedication, pride, and professionalism. And for me, one of my personal goals here across Mercy is to make my partners feel valued and part of a location that's innovative.
Excellent, and I love that we really are all partners. And I know as a VP in Revenue Cycle, you wanted to talk a little bit more about your Revenue Cycle team at Mercyhealth. What would you like us to know?
Absolutely. A lot of people don't realize that there's opportunities in healthcare that are not patient-facing, that aren't a doctor or a nurse sitting in a room with a patient. So our revenue cycle team is the group that's the kind of behind the scenes engine, right? We make the organization go. We work in patient access. So scheduling, registration, patient financial counseling. We have medical coding teams. So those are highly skilled individuals we'll talk a little bit about later. We have patient financial services. So it's the team that does all of the billing. They try to do the follow-up. They work with our cash posting team. And then we have a managed care leadership team. And they all really work dynamically to assist our organization in obtaining payment for the quality services that we provide. So don't get me wrong, revenue cycle is not just bill collecting, right? It truly is a collaborative environment. It is. It's a collaborative environment where our partners are, not only helping ensure our financial sustainability at Mercyhealth, but we also guide patients through their own financial sustainability and a positive customer experience that we try to bring across to all of our hospital clinics and locations.
Yes, the whole billing piece is a cycle, and it's not just pay the bills. We have to get in and investigate things. So thanks for calling attention to the importance of the entire revenue cycle team, because it truly takes dedicated and detail-oriented team members to make sure that each step in the revenue cycle is done accurately and thoroughly, and with an attitude of customer service, not only to patients, but medical professionals that are working with them and the other staff involved. So please talk a little about the positions you're highlighting for us today.
Absolutely. So today we're going to highlight a few of our more skilled positions that we're looking for. So these particular positions report up through our managed care area. So a lot of folks may not understand what managed care is. It's the area that helps us negotiate our payer contracts. They work on underpayments and overpayments based on how we were reimbursed by our payers. They do a lot of analysis, work with our clinical teams for denials and appeals, and they really help us to identify reimbursement opportunities and develop reporting tools. So here, what we're going to try to highlight today is that we're looking for several skilled areas, and I think the college might have some folks that could possibly fit the bill. When we think about what it is that we're trying to do, one of the biggest ones that comes to mind is my revenue cycle reporting analyst that you see here on the screen. For my reporting analysts, they're responsible to truly think as almost like a business intelligence person. It's really kind of diving in and not only creating reports, but analyzing those reports, being curious enough to understand perhaps what benchmarking initiatives might be going on, working through new and existing database evaluations, and helping our revenue cycle team sort of get to that next level through creating some data analytics techniques and tools. So we have a lot of opportunities in that area, not only in revenue cycle, but also in Mercyhealth as a whole. But really looking for some people who understand where data is going. I don't think I shared yet, but healthcare is typically a little behind the 8 ball when it comes to data and analytics. So we have a lot of room for growth, and we're really looking for people who are sort of curious and really want to make a difference in that space. One of the other things that we're looking for is what we call a revenue cycle reimbursement analyst. So this person also needs to have a very curious mind, but unlike the reporting analyst, this is someone who doesn't mind to sit down and have to go through pretty large stacks of contracts, whether virtually or in paper, and truly understand the payer landscape. As you may be aware, payer contracts are extremely complicated. I know myself, I've been in this industry over 20 years, and even trying to understand my own healthcare coverage is sometimes a challenge.
I absolutely agree. The complexity blows my mind sometimes, and it continues to change, doesn't it?
Absolutely. Absolutely. So this is the type of person that will really keep up with what's going on in the industry and truly understand how our contracts are written and how we're supposed to be paid, so that, you know, we can find those trends where, you know, perhaps a payer inappropriately paid us for, you know, 100 of the particular codes on these claims. And so they really are like researchers is what I like to think of them as.
My goodness, my goodness. Well, I know that's pretty in-depth, but what are some of the qualifications you're looking for in candidates for these particular positions?
So most of these positions require 2 to 3 years of experience. So when we think of experience, what we like to talk about in any of these roles, other than our RN analyst position, for the reimbursement analyst or reporting analyst, we think about experience related to research, reporting. It doesn't necessarily have to be in healthcare. We have one of our best reporting analysts actually comes from the banking industry. And did some, college career development in analytics and worked in banking for a few years before she started here. So one of the things we don't want people to be scared of is when we talk about experience, it's more about the research, or have you done reporting? Are you learning about reports and databases in schools? So experience can be very broad in that term. Mm-hmm. Now, for the one we haven't talked about on this slide, for our clinical denials and appeals analysts, we truly are looking for someone who is either in nursing school or has had some nursing experience. And the reason this one is so highly specialized is this particular person really has to understand what's termed in the industry as medical necessity, right? Payers like to argue with physicians quite often about whether or not the payer is going to pay for something because they don't agree with what the doctor is ordering. So we need a nurse who understands how to bridge the gap between our providers, our physicians, our hospital environments, and our documentation, and understanding and interpreting payer requirements for medical necessity. So that one's a little specialized. So there we are looking for someone who's either in nursing school or has had some nursing experience.
Excellent. Okay. Thank you for that information. We'll go on and talk a little bit more about some of the other positions that come up that are great places for candidates to contribute to the revenue cycle function, but maybe those candidates are a little earlier in their career. Tell us about those roles.
Absolutely, and what we try to do here is we think about what revenue cycle is we kind of think about the life cycle, right? So when we think about patient access, our patient access partners are the first line of contact with our patients or their families. So when you're entering through Mercy, you might be scheduling or registering in an emergency room, or talking to someone about, financial options that you need to address before you come in for services. All of those folks are patient access. So we have patient registrar, registration specialists. Some of the other ones that aren't listed here is we have like pre-certification specialists and financial counselors. And all of those folks are what we would consider almost like an entry level. So very little experience required for those types of positions, high school diploma. You will receive on-the-job training, and we have locations all across, like I said, 50 different communities in Illinois and Wisconsin. So lots of opportunities in that patient access area. And then we go into our patient accounts or patient financial services area. And this department is a little bit faster-paced environment. We have customer service, our cash applications and credit specialists, our billing, and our follow-up representatives. Now, these folks, again, could be an entry-level position. We will do a lot of on-the-job training. Some of those roles would be positions that you would move up into. What we do like to think about, though, is we're really looking for people that may have some form of customer service experience or a basic understanding of healthcare overall. For us, we're really looking to hire people that they like to work hard, they're not afraid to be innovative, and truly have upbeat attitudes and dispositions. We're coming out of this interesting time in our country, and I think a lot of folks are really trying to take a little bit of extra time to, be nice. And so we're really looking for folks that can kind of carry us forward into the next 5 years of sort of a new attitude and a new experience, and have a little fun with it. The last area in our revenue cycle team is our medical coding, and I mentioned earlier they are critical players in our revenue cycle team. They do a lot of review of clinical documentation, ensuring appropriate codes are associated to claims, which allows us to receive maximum reimbursement. They help with physician diagnostic coding and working with our physicians to help increase our documentation standards. So there's a lot of provider feedback, working with other areas, but very highly skilled individuals. Usually our coding specialists go and get their coding certifications. And we do hire in folks who don't have those coding certifications but are in the process. We have a lot of flexible work arrangements for our coders, and throughout all of revenue cycle, we're actually working on launching a true hybrid work environment for a great majority of our staff so that we can have some in-office time and a lot of remote time available as well. All of our positions across all of these different areas, have a nice benefit package available. We do work to ensure that we have a highly inclusive environment. And we focus very, very much on a work-life balance, especially now. Again, having come through a pandemic in this country, I think a lot of us have really started to reevaluate what it means to have a good work-life balance.
That's awesome. Very, very important and for many employers in this day and age. So very good to hear. I do like to take a moment to mention to viewers that while I know you're interested in speaking with Rasmussen University candidates, there's never a guarantee. You're not guaranteeing that they're going to be hired because you're, of course, speaking with candidates from a lot of other colleges and universities as well. So we just like to mention that. And let's talk a little further about what's going on in the industry. Do you have a little perspective and advice on industry trends? Maybe are there any myths about the industry that job seekers need to know? And you mentioned the pandemic, and especially in light of the fact we're still dealing with that, what kind of interesting perspective do you have for us?
Oh, so much to think about. You know, so first let's talk a little bit about industry trends, right? So three major trends in my opinion in healthcare are occurring. One is the shift, right? So really considering the hybrid environment, and what that means for us in administrative roles is really embracing technologies. So, you know, we're no longer having to ensure that we're chained to a desk. You know, just like having this discussion with you, we're doing it via the World Wide Web, right? You know,
right.
Ensuring that, yeah. So it's one of those things that we have to embrace it, and it is difficult because that's not what healthcare and administrative functions have done for, you know, eons, decades and decades. So it is a shift, and with that comes some challenges, like, you know, how do we keep employees engaged? How do we ensure that people still feel valued in their positions? And so those are all things that we're working really hard on. You know, if you haven't been in healthcare, it's really important to know that payer requirements are getting more and more difficult every day. You know, we have a lot of rules and regulations that come down from our government for Medicare, but unfortunately, we also have a lot of payers that really make it difficult for us to get paid for our services. So really having a curious mind and, you know, trying to ensure that you're staying up with all of that information and learning every day, I think is something that is really important if you think about healthcare.
Excellent.
You know, there's so much technology going on too that, you know, as we think about a curious mind, we have to ensure that folks understand, especially as we think about some of the folks might be coming out of the college programs, we have a lot of new technologies here, tremendous amount of new technologies.
What are some
you know,
of those technology advances that job seekers should be aware of?
Yeah, I mean, it's a great question. You know, we have, so we have Epic, which a lot of folks will be familiar with, especially in this part of the country because they're in Wisconsin, and we're implementing some of their new modules that are going to take us to the next level. So we talk about what we're calling the Benefits Engine Refuel, and it's a an application in the patient access area that's going to help them to, you know, better understand patient responsibilities, so knowing what your copay is, knowing if your insurance is valid and things like that. We've also partnered with a technological company called Vispa, and they're in our patient financial services area, and they help us to ensure that we do what's called working by exception. So in healthcare, we have had to basically touch every account every day, and Vispa works a little differently. So we take out accounts that don't need to be reviewed, and it allows us to do high value work, but it also allows us, this was critical for Mercy, it allows us to really work virtually because it keeps track of everything the users are doing. It helps us to potentially know users that need to be retrained, and it's constantly getting bigger and better. So it's a new technology that has really helped us through this pandemic. And then of course there's telehealth. We have this conversation all the time because there's, think about how much we do virtually, talking here on our phones, and physicians now have telehealth visits. And so we have to understand where that's going to take us in the next 5 years. I don't think we're going to get to the whole, Amazon thing where, you just, sign on and, see any doctor. I think patients still want to see their doctor, right? But we have to be ready for that. We have to be ready to not only provide that, which we do now, but of course, technology can be a little difficult. And we also have to know how to get paid for it. So there's just a lot going on here. So really, as you think about healthcare, the sky's kind of the limit.
So what kind of advice do you have to share with job seekers about entering the industry, or even for experienced job seekers?
Well, so I've shared a lot of highlights, and I tend to be kind of excited about everything we're doing, and I'm super excited to try to explain to folks who Mercyhealth is. But the thing that people need to make sure of that if you're trying to enter the workforce, the pandemic changed a lot of people and a lot of industries. For healthcare, you see it all the time right now. Healthcare employees are worn down, and they're really suffering from burnout. As we consider kind of what's happened around the country, we have to continually be aware of our treatment of our patients and each other, our Mercyhealth family. We have to be willing to embrace change and continually look for ways to create efficiencies while, continuing to be kind to each other. The government rules and regulations aren't going away, and they're going to continue to create requirements for my areas and revenue cycle for billing and managed care and reporting. And healthcare job growth estimates are still projected to add about 2.4 million new jobs by 2029, and that's much faster than most other occupations.
Sure.
So, I think my biggest advice for job seekers is, if you're entering back into that scene, or if you're new to that scene, don't get discouraged. Be kind. Be willing to be flexible and learn and grow, and just be nimble and be positive.
Absolutely. That whole attitude piece is never going to get old. That's so important, no matter what industry you're in. So very good advice. And at this point, I'd like to thank you for all of the very educational information you've shared with us today about revenue cycle opportunities at Mercyhealth and about the healthcare industry overall. Are there any last thoughts you'd like to leave us with?
Yes, thank you so much, Amy. I appreciate you having me here. I guess my final thoughts are just that, Mercyhealth, we do a lot more than just deliver advanced healthcare. For us, it's a place to really, truly explore your potential, and we are committed to push the boundaries of what we can be. We're looking for partners who can grow, think, dream, and create. Our culture thrives by embracing diversity and rewarding imagination, and we're looking for achievers and leaders and visionaries. It's really about each person bringing skills and enthusiasms to the challenges that are constantly evolving in revenue cycle.
Complexity and evolving. Words we're not going to stop here, definitely. So Kimberly, this has been a great presentation, and I thank you so much for joining me today. I want to remind interested candidates that they can go to the Mercyhealth career site to see what other opportunities are available. I also want to welcome my students and graduates from Rasmussen University to reach out to me if they need assistance with anything career related. And I want to say thank you for everyone viewing this informative presentation about Mercyhealth. Thanks for everything.